Now we up and we'll look at the next type of gait. Okay, and we get to also, you know, um, talk about this gait, talk about how it looks like, you know. So this is what is known as an arthrogenic gait. Arthrogenic gait. Okay. So for the arthrogenic gait, you know, they also call it the stiff knee or hip. Okay. So yeah, walking is kind of like you're dragging the other leg. It's not that you're lifting it. You understand? So arthrogenic gait is also known as a stiff hip or knee gait. So it's an abnormal walking pattern and it develops when a joint, most often the knee or the hip, becomes very stiff, very painful, fused. Now the body is trying to adapt by altering what movement to avoid what stressing the affected joint. But this compensation produces a characteristic gait. Okay, so it's just joint stiffness due to arthritis, could be joint fusion, could be contractures, could be pain. So mechanical restriction is there, you know. It's not actually the nerves that have the issue. The issue is actually from the bones. Okay. So can I say it's stiff? You can't actually bring the leg up. You just have to be drawing it, be dragging it because this joint is very stiff. All right. So appearance: the affected leg is kept straight, cannot actually be bent. Okay, so it's kept straight and stiff during walking. Patient swings the leg outside in a semicircle to clear the ground. Hip may be lifted higher than normal to allow the foot to be able to pass. You know, step length is often reduced. Compensation: the trunk may tilt towards the opposite side. Okay, this will now increase the use of pelvic rotation to advance the limb. All right. So causes could be ankylosis, osteoarthritis, hip contractions. Okay, that's on the hip. On the knee could be all those arthrofibrosis, you know, post-traumatic stiffness, advanced arthritis, you know. Sometimes maybe after a surgery, you know. So clinical significance is it actually indicates that there's a mechanical restriction, you know, often associated with pain, reduced mobility, compensatory strain, okay, on other joints.